Diane Kennedy.
Hello.
Hello. I'm Paige. I'll be your clinician helping you out today.
All right.
And you're just in for a regular hearing test today, correct?
Yes, I am.
All right. So what we're going to do here is I'm just going to sit you down and ask you a few questions about why you're in today, get some information from you, and then I'm going to take a look inside your ear later, look at the inside, see if everything's looking all healthy, and then I'm going to take you over and do a tympanometry on you, check the pressure in your ears, make sure everything is good there, and then we'll take you into the hearing booth and do your hearing screening.
Okay.
Sound good?
Yes.
Okay, so I'm just going to have you confirm your name and your date of birth.
Okay. Diane Kennedy,
Hmm.
and birthday is 1/12/1963.
Okay, and today is March 6th, so everything is all set. All right, we're just going to get started. What is your primary reason for coming in today?
Well, I am now 56, and since I've entered kind of my 50s, I've kind of noticed a little bit of hearing loss, I believe, in certain situations. So I'm just kind of coming in to see if maybe I might need to, have a hearing test and see if that is confirmed or not.
Okay. How long have you noticed your hearing loss?
Well, maybe the past, I think 2 years, possibly. My family kind of says to me, "You can't hear, Mom." So I hear a little bit of that from my family members. So they tease me that you need a hearing aid. So I'm getting that feedback a little bit. So I thought, well, I guess I better come in and have a hearing test.
Yes, well, that happens a lot. What do you feel is the cause of your hearing loss?
Well, I know for a fact that I probably have some hereditary loss. Both my father, on my father's side, they have had some hearing loss. And my dad wears hearing aids, and my younger brother, who was just a year younger than I am, he also has hearing aids. So I know for a fact it must be some hereditary.
Okay. And you think your hearing loss was just kind of gradual or
I think
more
it
sudden?
is. Yeah, it's been, well, I think it's gradual.
Okay.
It's definitely gradual. It's nothing sudden. So I think it's just kind of possibly with age a little bit.
Okay. Is there a certain ear that you hear best out of, or kind of both?
I think I probably hear maybe better out of my right ear, and it might be my left that I tend to maybe lean in a little bit more to listen harder. So I'm going to say I think I hear better on my right side more than my left side.
Okay. Is your hearing better on some days other than others?
I would say yes, and it probably depends on what situation, what environment I'm in too. If it's maybe quiet, if there's a lot of noise.
Okay. Have you ever had an occupation where you're exposed to loud noises?
Loud noises.
Such as being in the military or maybe even attending loud concerts?
Okay. Well, I have had, not necessarily working. I've not been in the military, but I'm trying to think if I've ever been around where there's been loud machinery working. I used to work in a pharmaceutical company, but I was in a business environment, so I didn't really have, noise there. I might have maybe heard, walking through the plant. And I did attend some concerts when I was younger, and possibly, just the general turning up of music.
Okay.
I didn't play an instrument or anything, so, and my age, we did not really have and utilize headphones or earplugs, so that wasn't really around for us. So I can't blame it on that.
Okay. And you did mention that your family members had hearing loss.
Yes.
So I'm going to say yes. And you said your dad and your brother, correct?
Yes, my dad and my younger brother.
Have you ever had your hearing tested before today?
I'm going to say no, because if I've ever had a hearing test, oh golly, I can't even tell you when the last time it was, if I ever really did. So no, I haven't really had it tested.
Okay. Have you ever seen a physician for your hearing?
No, I have not to see, any audiologists, or, I mean, I do have a primary doctor, but I've never really even mentioned anything to them about, hearing loss.
Okay. So that was kind of your general history. Now I'm going to ask you a few questions about your medical history.
Okay.
Have you had ear aches or drainage from your ears
No.
within the last 90 days?
No problem with any ache. I never really even, have any earaches, and no drainage that I'm aware of. No. And I don't really even have that much of a wax buildup. I've never even ever had my ears cleaned. So,
do you use Q-tips?
Probably a little bit. Sometimes, I guess. I know that that's not the best thing to do.
It's not.
So,
have you ever had any medical or surgical treatments for your ears?
No, nothing done medically. I've just had my ears pierced, but nothing inside.
Okay.
So,
do you ever have dizziness, balance problems, or falls?
No falls, no balance issues. I might have had a little bit of dizziness, one spell maybe, who knows, couple years back, but it was very limited. So
Okay.
no, nothing that I can account for.
All right. Do you notice any tinnitus in the ears, which is ringing, buzzing, or roaring?
Not really. There may be on occasion where it kind of feels like my ear might be plugged a little bit, and then I just hear a faint little buzzing, but nothing like on an everyday basis or anything like that.
Okay, so it's not bothersome.
No, it is not.
Okay.
Not really. No.
Okay. And you said kind of when you do hear that, it's a distant, soft buzzing.
It would be a very light, faint little buzzing.
Okay.
Yes.
Now, are you currently taking any medications?
Yes, I take one medication, and that is all that it is. And it is levothyroxine is what I take, and it is thyroid medicine. So that's the only medication that I'm on.
Do you have any open sores, bleeding, or drainage at this time?
No sores, no anything.
Okay. Do you smoke or use any other tobacco products?
Absolutely not. Never have. Don't plan to.
Okay. Do you have or have ever had any of the following?
Okay.
Arthritis.
No.
Allergies.
No allergies.
Bell's palsy.
No.
Cancer.
No.
Concussion or skull fracture.
No.
Dementia or Alzheimer's.
No.
Depression or anxiety.
No.
Diabetes type 1.
No.
Diabetes type 2.
No diabetes.
Hepatitis.
No.
High blood pressure.
No. I've had pretty low blood pressure.
High fevers.
No.
HIV.
No.
Measles.
No.
Meningitis.
Mm-mm.
Multiple sclerosis.
No.
Mumps.
No.
Pacemaker.
No pacemaker.
Parkinson's.
No.
Scarlet fever.
Mm-mm.
Seizures.
Nothing.
Stroke.
No.
Tuberculosis.
Nothing.
Or vision problems.
No.
Okay. All right. Now, do you have difficulty hearing or understanding in any of the following activities? Watching TV.
I would say for the most part, not really, but there are times it depends on the tone of the sounds on the TV. If it's low, I might need to turn up the volume just a tad, just to get the clarity. But it just really depends on the actual the programming.
Okay. What about in restaurants?
No, I'm okay in restaurants.
Meetings?
Sometimes in meetings at work where I notice the most, I work in a reception environment. I work for a medical clinic, and we've got patients on either side of me, and so there's a lot of, I would say, maybe background noise. And if I'm noticing the most if a person has a low tone in their voice, that sometimes I might have to ask them to repeat.
Okay.
So really more in a work setting.
Okay. So you don't have any problems hearing on the telephone?
No.
Or watching movies?
No.
Or at a worship service?
No.
Okay. Do you happen to have trouble hearing a telephone ring?
A telephone ring? No.
A doorbell?
No.
Alarm clock?
No.
A fire or smoke detector?
No.
A siren?
No.
Or a baby crying?
No. All those are, very clarity. So that's all loud sounds. So, I mean, I have no problem there. It's more on the lower, quieter tones.
Now, I'm going to ask you 3 areas where you have the most difficulty hearing or understanding. Can you think of any other times besides at work with low-toned voices?
Okay. Maybe if in a conversation, and depending on if somebody is across the room and they're, speaking more mumbling, I usually have to say, "What did you say?" So maybe in a distance situation where somebody's, clear across the room, and if they have more of a low voice. And maybe also somebody that doesn't enunciate very well, they just kind of ramble on a little bit. I'll have to say, "What did you say? Can you repeat that?" And then I'm trying to think if there's really any other, if I'm outside and the wind's blowing, if it's windy on a day and somebody's, if I'm walking behind somebody and they're talking, standing in front of me, it depends on sometimes I might have to say, "What?" So.
Okay. All right. When you talk on the telephone, which ear do you use?
My right. Yeah, because I think I'm right-handed, so it automatically.
That's the next question. Are you left or right-handed?
No, I'm right, so I automatically hold the phone right up to my ear, so right side. So, and I'll switch over to the left depending on maybe where I'm at, but
mostly right.
Mostly on the right-hand side.
Okay. Is there any other information related to your hearing that you feel might be important for the audiologist to know?
Okay. Well, really, I guess I just wanted to reiterate that obviously I've got hearing loss in the family, and my dad is he's in his 80s. I'm trying to think how long he has had hearing aids. He has had two. He's on his second set right now, and I believe he has at least been wearing them a good 15 years. So maybe later in life did he get hearing aid. My younger brother, did you go out?
Okay, still going. Your younger
And
brother?
then my younger brother, who is will be 55 this year. He, I believe he's been wearing hearing aids now for the past 4 to 5 years. So he kind of got his first pair, and but he was a musician. He played drums, so he had a lot of environmental, loud noise, and obviously playing the drums, and he was in the band. So, and he now is wearing the type of hearing aid that goes inside the ear and is implanted in the ear canal.
Okay.
So that's really just something that I know. I've got the hereditary background, so just thought I would see where I stood at my age.
Okay. All right, last couple questions here. Probably going to go fast because you do not wear a hearing aid. Have you ever worn a hearing aid?
No.
No.
I've never even had one in my ear.
That concludes our case history. So now I'll take you over to our machine where we will look inside your ear canal and make sure everything looks healthy, but that concludes our case history.
Okay, thank you
Very
much.
good.
All right.